how do you reverse the effects of knee pain? I'm going to show you 3 ways. It's not a one size fits all. It's a spectrum. It's a progression. It's a regression. This is one thing I think doctors, physical therapists, and physios miss, but this trainer, knees over the toes guy, Ben Patrick here, has kind of figured out a great system for it. And I'm going to walk you through exactly what's going on here. Hopefully you'll find a spot to fit yourself in, and we'll talk about a couple concepts along the way. But the first thing I want to show you here, this is basically just a step down. So we've got a little bit of an elevation. We're bringing this knee forward, and then what we do is reverse out of knee pain. So you control the weight forward, and then you drop back. Now, in this first one, this will be the simple part of the spectrum. So if you've got a lot of knee pain, if your knees are really kind of beat up, this is where we start. You'll notice he's got a little support over here. So regardless of where you're at, you can kind of take some pressure, poundage off of your knees by adding this support over here. You're still going to go up on your toes. You're still going to let this knee go over your toes. That's going to really start to activate this VMO. You'll see his quads working big time here. But what you do is kind of hold on to this so you have a little extra balance, a little extra support, and then we do rep after rep after rep. Now, if this is too easy for you, either increase the reps, you go a little slower, or you progress to the next one. And in the next one here, we'll go a little bit higher. So here we go. We're going to go a little bit higher. We've removed the support. You'll see he's actually now clenching his fist. This is called radiation. So he's staying really tight. This is making his core nice and tight. But what happens is he's a little bit taller. We've gotten good at it. We slowly go down and then pop back up. So you're literally reversing the way your knee hurts. Typically knees hurt when they go forward, but now we're strengthening going backwards, right? So this is really good. We're going way on the toe. You'll see this knee way over the toe. However, we've already done that first set. And if you do this one and it's too painful, then we simply go back to the first one and we perform a bunch more reps. Then we raise the roof here. You'll see he's a little bit higher. He's got a nice box, and clenching the fist and slowly forward and then reverse back. So this foot is just reaching out as a guide almost. All the work is done by this back leg here. And then once you've progressed to this, if these are all easy for you, you're a pro. We're going at the same height, except this time we're adding some weight to the back. So again, same thing. This is a good view here. You'll see how that knee is going over. You'll see the quads working. He's getting a lot of what we call grounding in physical therapy. The front of this forefoot, which is where people spend a lot of time as they walk forward, it's called the toe off phase. Now we're recruiting in the quads and we're going to reverse back out of it. So you'll see him really kind of focus slow forward, reverse out of knee pain. Slow forward, weight on the toe, reverse back out. It's a very simple kind of progression, but once you kind of go back to the first ones, you'll see that if it's too much, if you progress too quickly, you can just simply go back. You can lower the weight or you can give yourself a little bit of an assist. Even if you go to the kind of next level here and it's still a little bit too high, you can actually back down and get yourself a little assist, kind of like the first one, so that there is a natural progression. This is one thing that I see a lot of physical therapists, a lot of physios, a lot of doctors missing in rehab programs. They give one exercise and they say, go for it. In this program here, we have a simple progression and regression such that you find the sweet spot and then you can slowly progress. This is how results maintain. This is how you keep a strong knee. So once you get out of knee pain, it's time to then build some strength into the knee. So we start easy. You'll be able to get comfortable with this movement. You're really not bringing that knee too far forward. You're not putting too much weight. You've got an assist here. Then you go over to the second one. There's no assist. There's a higher box. You're slowly going down and then reversing back out of that knee pain. And then we go to the top. We've got a little extra weight up top. He can go even higher if he wants to. We let the toe stay down. We go down slowly and then reverse back out of it. So find your sweet spot. 12 to 15 reps of these. Find what you can do it well, and then progress. I'm Dr. John Cybulski. This is the Anatomy of Therapy. We've got a podcast. We did a couple good episodes on knees. I'll put a link to that in the bio below if you like it. hit the subscribe button, smash that like button, and we'll see y'all next time. Have a great Valentine's Day.